Hello, my name is Ken Kinter. I'm an assistant professor at Rutgers University, and this presentation is about suicide among America's veterans. As usual, if you like what you're hearing, go tell somebody. We're welcome to comments and feedback and suggestions for future presentations. In fact, we'll talk at the end about where this one came from. First off, credit where credit is due. The project that I work for at Rutgers is called SHPRI, the State Hospital Psychiatric Rehabilitation Initiative, and its purpose is to improve the quality of care and working conditions in New Jersey state psychiatric hospitals. And it is strictly not possible without financial and other assistance from the New Jersey Department of Health. So we thank them for their continued support over the years that makes our work at the hospitals and this work possible. So what we're going to talk about in this presentation, we're going to start by comparing the suicide rates between the veteran and civilian populations in the United States. We're going to talk about the risk factors for veterans and how they're similar and different from the civilian population. We will discuss emotional warning signs, verbal warning signs, behavioral warning signs for suicide for veterans. And to help the loved ones and those of us who support veterans, to provide some guidance and resources as well to help out as far as next steps, what to do when. Just one other comment before we go any further with this. I just wanted to mention that I am not a veteran nor active military. I've grown up 10 minutes from a major military base, so it's part of the culture all around, but I just wanted to be perfectly clear about that in case anyone is curious. So, statistics between the general population in the US and veterans. So in 2020, we had about 46,000 suicides, and that has been on a gradual increase. And we have a couple other videos on suicide that cover this data in a little more detail. So you might want to watch that either before or after this. It'll give you a little bit more background on the general population. So 46,000 among the overall population, about 6,000 among the veterans. So it's about 8% of the population, but 13.5% of the completed suicides. So that's an elevated number. A big part of the reason for that is veterans are more likely than the general population to attempt suicide by firearm, which is the most lethal means. And also they fit some of the demographic categories for people that complete suicide, for example, being male and the age bracket as well, as far as more for attempts. Overall, as we mentioned in the other suicide video, it is the 11th leading cause of death in the United States after a brief appearance in the top 10. Among veterans, it is the second leading cause of death. And I've actually been glad to hear there's been a lot more coverage of it in the news recently, so I'm happy about that. So risk factors for veterans. Now, interesting that many of these are exactly the same for civilians, but there are some important differences. So relationship problems, financial stressors, legal problems, feeling emotionally overwhelmed, trauma and PTSD, which that would be a fascinating study between the veterans and civilian populations. So these sound pretty typical. I mean, these are common among suicide risk for anyone. Inability to stop negative feelings. Where it gets interesting for the veterans is this whole idea about the transition back into civilian life, feeling that they don't belong in society, that they don't fit in, and the difficulty in re-entry, that whole thing where you step out of civilian life into military life and then back again. That seems to be major issue to deal with and can complicate all of these other pre-existing things. You see addiction, pre-existing psychological problems can exacerbate all of those things. My understanding of a transition out is a person comes back, they do 30 days on the base, and then they're out. So you have 30 days to decompress from however long you've been in and wherever you were, and you're on a base, which is an artificial environment. It's still a military environment. And then you're back to being a civilian again. So I don't think the difficulty of that transition can be overstated in terms of setting the table for maybe some of these future problems later on, including suicidality. The probably major shocker or takeaway for me from this whole process was that combat exposure did not really correlate with suicide. That would have been intuitive for me. Half of the military personnel who die by suicide have not been deployed or been in combat. So to me, that leans more toward the transition as a major factor and less exposure to to combat, or the things that we might think about as civilians that might be triggering for suicide. So additional risk factors for veterans: the idea of hopelessness, that things will never get better, feeling that they're a burden, especially from coming from a position in the military to then feeling like a burden. I imagine that would be even more. No one wants to be a burden, but I think even in that situation, it would be even more difficult. Self-hatred, the feeling that the person is defective or unworthy of love, the fact that they can't tolerate the stress of the situation, feelings of guilt. And this last one, I don't think can be overstated either: feelings of disconnectedness. They don't belong to the military anymore, but they don't belong to civilian life either. I think that's a really critical point if that transition isn't made. So some of the warning signs, again, and you can hear about this transition not being complete: cleaning a souvenir weapon, visiting graveyards, preoccupation with the military or news channels, wearing a uniform off duty and maintaining the trappings of military life into civilian life, being overprotective. When I see standing guard, I think of sentry duty, ongoing, hoarding medication, alcohol use, this whole thing about "you wouldn't understand." And this is a big issue. Veterans feeling like they can't speak to anyone but other veterans, or can't speak to anyone in general about what's going on with them. And then avoidance of eye contact, some pretty standard PTSD kind of symptoms. Now, this moves into even more of a danger zone when we're talking about suicide, when these things start to happen. If the person starts to talk about killing themselves, or feeling hopeless, having no reason to live, again, being a burden, feeling trapped, or being in unbearable pain, medically, psychologically, whichever. These are the red lights. These are the, because again, that person already has military training, they have familiarity with firearms, presumably they have access. So by the time we get here, things are at a critical point. So some of the mood symptoms you'd be looking for are depression, anxiety, loss of interest in activities, a lot of anger, rage, and again, feeling humiliated and shamed. Again, they don't carry with them the status that came from military service, and they haven't fully acclimated back into civilian life yet. Some of the behaviors: increased use of alcohol or drugs. That's a giveaway right there. Person researching suicide, pulling back from activities, pulling back from people, disruptions in appetite and sleep, saying goodbye, giving away prized possessions. Again, these are all real alarms that something is wrong and things are going to get worse. And then also this sort of anger, agitation, aggression, and fatigue. So if you are someone and you have familiarity with someone who's in this sort of situation, there are things that you can do about it. And again, you don't have to necessarily be a therapist or anything like that to be able to approach someone. It's just a matter of having an honest conversation with them, a private conversation with them, where you listen. That's most of what you do. 90% of what you do is just listen, tell them that you care about them. If it gets to that point in conversation, ask them directly: are you thinking about killing yourself? Have you tried to kill yourself? Have you taken steps to kill yourself? Use the direct language: not hurting yourself, not be here anymore. That's all covered in the other suicide videos as well. Encouraging them to talk to someone else after you, whether it's another veteran, whether it's a therapist, whether it's a doctor, whether it's the resources we're going to share in a few minutes. This isn't an argument. We're not trying to talk them out of suicide. We're not trying to talk them into or out of anything, except just keeping a discussion going. First with you, from a place of caring, and then ultimately for the idea of getting help and support from somewhere else. So years ago, my wife and I were on vacation, and we found out about this gentleman who lived outside of Sydney, Australia. His name was Don Ritchie. And he was a Navy veteran. And if you see the picture out the back, there are these really pretty cliffs that are outside of Sydney, really beautiful. And the whales go by there. It's really, really, really nice. However, like many picturesque places, a lot of people go there to attempt and complete suicide right off of those cliffs past that fence that you can see. So Mr. Ritchie lived right near where these cliffs are. And if he saw people going over the fence or walking around or just kind of looking out at the cliffs, he would walk over. And his whole approach was, "Can I help you in some way?" And he would invite them to his home for a cup of tea. Well, hundreds of people took him up on that offer. And they estimate that he saved over 180 people just by walking up to them saying, can I help you? Would you like a cup of tea? And just being able to talk to them. There's no major advanced counseling techniques going on here. Some of these people came back and thanked him years later because he was the right person in the right place at the right time and saved people's lives. And he won the Medal of the Order of Australia for his efforts. And the simplicity of his approach was probably the best part of it, and just coming from a place of kindness. And again, he was an Australian Navy veteran as well, so he had a military background, but I don't hear a military background in his approach, just that he just came up to people like a human being and talked to them. And what I think he did was he tapped into the ambivalence that a lot of people feel about suicide. They don't want to kill themselves. They don't see how this ends any other way. They just don't see any other option. Or they feel so alone that there's no other way. Well, he kind of contradicts that by approaching people. There are very many people who have attempted suicide who said, if one person had stopped me or said something, that would have changed things. And for many people, Mr. Ritchie was the person who changed those things. So all the credit in the world to him, but it also shows that approach works. You don't have to have anything really extravagant. Sit the person down, have a cup of tea or the equivalent, and just talk. Just talk to that person. Make a huge difference. So just in summary, to wrap up some of the things we talked about, suicide rates are higher for veterans in the overall U.S. population. Some of this is due to choice of method, but also their overdose completion rates are higher as well. So I think there's some other factors involved in there as well. It's not just the choice of firearms. Most risk factors for suicide for veterans are the same as those as a civilian population, with the significant exception of reentry into civilian life, which there's probably some really, really good research on that, which I will probably be taking a look at when I redo this. Combat exposure was not found to be a significant contributing factor. What great papers these would be. There are many verbal, behavioral, emotional warning signs of suicide for veterans. Many of those resemble those for civilians, with the exception of the evidence of that sort of reentry, that person isn't military anymore, active military, but they haven't really fully engaged with civilian life either. If you're concerned about a veteran being potentially suicidal, the Don Ritchie method, I think, is unassailable. Sit down with that person with a cup of tea or a cup of coffee or whatever it is, and just talk to them. You care about them, hear what they have to say, and say, let's talk to somebody. There are resources, there are things that are available to you out there. And the world is better with you in it. And the other good news is there are a phenomenal amount of resources, more than I could even follow up on. If you want these resources, I can show you where they came from, and I'm also happy to send you the PowerPoint or these things with the links so you can access them directly. They were more than I could follow up on, and I'm glad that these are all here. And some of them are straight VA, and some of them are other things. The one I would start with is right here on the top, and I've seen a lot more TV commercials about this lately, which I'm happy about. Veterans Crisis Line, 988, which is the national suicide hotline. But if you press 1, that's specifically for veterans. So I think that's a great addition to that as well. And that's national and that's active. And then you have these other ones as well. Some of them you can speak directly to veterans. So there's a lot of services out there. This is where I got all the information from this presentation from. So any of the stats or any of the data all came from here. And again, you might want to check out the other suicide videos on this channel as well, because we always try to keep our data current. So the last piece about this is where this presentation came from. As I mentioned before, I'm not active military, nor am I a veteran. However, I had a conversation with a good friend of mine, retired Lieutenant Colonel, U.S. Army, Dennis Yates, and both of us are pictured over on the side back when I had hair. And he was looking for some information on this, and I did not have that information available, and that was not an acceptable answer. So this presentation comes directly from my gratitude for those people who have served and are serving, and also my desire to help those people that are struggling with transitioning back into to civilian life. Again, our world and our society is much better with these people in it. So with that, I'm going to thank you for your time. Thank you for watching this, and check out our other videos on this channel. And again, I thank you for your time. Take care.